Medication doesn't fix inflammation, it just masks it. And relying on those medications will never get you better in the long run. When you're dealing with chronic pain, fatigue, or weight gain that won't move no matter what you try, the standard approach is to manage the symptoms. Something for the pain, something for the energy, and you feel a little better or you don't. And either way, the persistent low-grade inflammation is still there. I'm Dr. Savir Rao, triple board certified in anesthesiology, pain medicine, and functional medicine. I run two practices, one focused on chronic pain, the other on integrative and functional medicine. I track inflammatory markers in my own patients and in my own lab work. And what I've seen across 50,000 patients is that the most effective tools for bringing inflammation down aren't prescriptions. They're habits, 7 specific ones that can bring inflammation down the fastest. And that's what the video is about. And if you actually do the 7 things I'm going to explain to you, you'll feel different in weeks. Point number 1, food becomes medicine. Let me tell you what I changed first in my own life, and it starts with the food. I didn't go on a diet. I didn't change how I thought about food. I changed how food actually works in my body. You need an anti-inflammatory baseline. I don't believe in complicated eating plans. Instead, I think about removing what actively makes inflammation worse in your body. For most people, that means cutting out processed seed oils, refined carbs, and anything that spikes your blood sugar super fast. You're not doing this forever, just long enough to bring you down to baseline. When I stopped eating those 3 things, my inflammatory markers dropped 35% in 3 weeks. My patients see the same thing happen. Habit number 2, eat the foods that measure down inflammation. Once you stop eating what inflames you, you fill that space with food that does the opposite. Salmon and other fatty fish, olive oil, colorful vegetables, nuts, berries. These foods have omega-3s and polyphenols that actually turn the body's inflammation signals down. I try to eat salmon 2 times a week, and that's not because I read about it online. My own lab work results showed that the inflammatory markers drop when I do. People always ask if this is hard or confusing. It's not. Here's the simple version. Stop eating oils that make inflammation worse, eat foods that don't do that, and pay attention to what happens. In 3 weeks, your body will tell you if it's working. Point number 2, movement as an anti-inflammatory medicine. Changing what you eat stops the problem from getting worse, but movement is where your body actually starts healing faster. You need both strength and cardio, structured differently. This is what I do. I lift heavy weights 2 days a week, not for a long time, just for about 20 minutes, but I really push it. Heavy compound movements. Your body responds to that by turning off inflammation for days afterwards. On the other days, I walk 30 minutes. Low intensity, that's completely different for your body. One type of exercise tells your body to adapt and get stronger. The other helps your nervous system calm down, and you need both kinds. Movement timing changes everything. I move in the morning, not after hours, not after eating, not right before sleep. Morning, on an empty stomach or after a small breakfast. That timing shifts your hormones and brings down your inflammation for the whole day. Most people exercise when they can fit it in. That's fine if you just want to get healthier. But if you want to specifically lower inflammation, when you exercise matters. Moving in the morning gets your immune system ready to run better all day long. If this way of thinking about things helps you, I post new videos every single week about how to work on what's actually causing your health problems. Subscribe so you stay in the loop. Point number 3, the diagnostic turn. Here's what usually happens next. People change their food, they start moving more, they feel better, and they never actually check if it's working. Habit number 5, you have to measure it. I order inflammatory tests on my patients, CRP, homocysteine, IL-6, TNF-alpha. These measurements show you whether you're actually turning down the inflammation or just feeling better because things are changing. I had one patient who felt great after changing her diet, so she stopped paying attention. But when I checked her labs, her inflammatory markers were still pretty high. We had to take a deeper dive. Turns out she had hidden food insensitivity that was still fueling it. Without that test, she would have never known, and we would have never got the improvement that she needed. You don't need me to order these tests. Your own doctor can do it. But you need to know your starting point and test again in 6 weeks. That's how you know if what you're actually doing is working. This is the difference between feeling better and actually measuring that things got better. Point number 4, the missing piece, sleep and stress management. I work about 80 hours a week. I could talk all day about food and exercise and lab work, but inflammation has something fueling it that most patients never even think about, and that's managing your sleep and stress. Habit number 6, sleep and stress management are not optional. If you're inflamed and you're not sleeping 8 hours, or your body is stuck in stress mode, you're fighting an uphill battle. Your heart rate variability is going to be way off. When your body makes stress hormones like cortisol, it actually increases inflammation. When you don't sleep enough, your body can't recover and clean out the inflammatory markers that are building up. Here's what I do for myself. I treat sleep like it's actual medicine. No screens after 10 o'clock. I keep my room as cool as possible. And that's pretty much it. It's simple because it actually is simple. As far as stress is concerned, here's my strategy. I move my body in the morning, I get outside in the sun early on, and every single day I do something that has nothing to do with being productive. Something fun, a walk, coffee with someone I like, 30 minutes where I'm not trying to solve anything, just time to myself. That helps lower your baseline stress hormones and improve your overall parasympathetic tone. My patients see this work because they come back and their inflammatory markers are better. Sleep and stress management are that powerful that they can see changes before we even start changing their diets. Sleep and stress management are really, really critical to your overall improvement and health. Point number 5, the Tonight test. I just walked you through 7 habits, but I'm not asking you to do all 7 things starting tomorrow. Habit number 7, you start with one thing that's going to change fastest for you personally. For most people, that's movement. You can move tomorrow morning. You don't need to buy anything special. You don't need to reorganize your kitchen. And when you start moving, it actually triggers some of the changes on its own. It actually triggers some of the other changes on its own. You sleep better and your stress hormones go down. For someone else, the fastest change might come from sleep. If you're really inflamed and you add 8 hours of good sleep, that alone can lower your inflammatory markers in about 10 days. Here's what I tell my patients. Try this. Tomorrow morning, move for 20 minutes. You don't have to go hard, just move. Walk, lift something, stretch, whatever feels good. Then for the next week, notice what happens. Are you sleeping better? Do you have more energy? Does your body feel less stiff? One habit that you can actually do every single day beats 7 habits that you try to do but skip most of the time. If you actually do this, if you move tomorrow morning and then build from there, you'll be able to measure it in 3 weeks. 20 years of treating people in pain taught me something important. Most pain isn't about pain. It's about inflammation you don't even know you have. The way people usually fix it isn't by adding more stuff. It's by stopping what inflames them. If you want to dig deeper into what I've learned from treating over 50,000 patients about what actually causes chronic pain and what actually fixes it, watch this next. I put on a video on what 20 years of chronic pain medicine taught me that I'm not supposed to say aloud. I'll link it right here.